Hi, this is Tim Mitchell, and I want to welcome you to another episode of Mitchell's Minute. Today we have a guest, one of our pharmacists. Her name is Nickey, and she is a pharmacist at our BioEthics Infusion and Compounding Pharmacy here in Neosho. And Nickey, I want to welcome you, and if you can just tell me a little bit about yourself so that our listeners can maybe learn a little bit more about another pharmacist here.
All right. My name is Nickey. I've been a pharmacist for 25 years in various settings, anywhere from Indian Health to chain, retail, community, and now here with Mitchell's and BioEthics. Enjoy learning new things and enjoy expanding my knowledge in pharmacy, and always enjoy helping patients.
So BioEthics Advantage is a different kind of pharmacy. I know some people have heard of it, some people have not. Can you tell me a little bit about what kind of pharmacy BioEthics is? Is it something that somebody can just walk into and learn more about what's going on? Do they have to call you? Tell me a little bit more about that.
BioEthics is a locally owned specialty compounding pharmacy. We are a closed door facility. So no, technically you can't walk into our facility, but we can and do take care of patients on a compounding at a compounding level with hormone therapy, IV home infusion therapies. We work closely with Mitchell's drugstores as well in providing compounding really for the Neosho and Joplin area.
Okay. And so being closed door means they can still call in and they can set up an appointment to meet with you, but they can't just walk in and buy Tylenol or something like that.
Correct.
Okay.
Yes. We don't offer the traditional over-the-counter therapies that most pharmacies do offer as an open pharmacy setting.
Okay.
And yes, we are available over the phone. Additional services that we provide are hormone consultation with pharmacists, hormone lab testing, saliva lab testing. We carry various supplements that we have patients purchase through our clinics as well.
Okay, very good. And so we are actually broadcasting this or filming this at a different location than where you have been. You want to tell us a little bit about this location
Yes.
and what's going on there?
We're very excited about making a move here in the next couple months to a new facility, a more streamlined facility where we can provide better compounding services to our patients, IV patients, home therapy patients, hormone compounding, as well as other compounding. We are upgrading a facility to be able to accommodate some of the changes that have happened here lately, to be able to provide continued and advancing our services to patients.
So, and if you're not sure where the location is, we have a Mitchell's downtown drugstore, and it's actually just next door. It's just east of this building. And this is the old Empire District Electric Company building. And it's actually getting a nice new coat of paint and flooring and new walls in different places. And there's construction going on as we speak. In fact, there's flooring setting around us, and we're very excited about the opportunity to be able to bring this as a service to people in Southwest Missouri and our community. So tell me a little bit about infusion therapy and compounding and so forth. Let's talk about infusion therapy. What's the big deal about infusion therapy? I thought if you needed infusions, you went to the hospital to get infusions. What's the advantage of what we do here?
Well, what we do allows patients to continue their therapies that are instituted in most cases in the hospital, but they can go home in the comfort of their own home around their family. We provide antibiotics and other IV therapies that they can be administered in their home with education to patients and family members.
And then a nurse would visit them periodically.
Yes.
And
we have
a
nurse on staff or nurses on staff that do initiate the education and the treatments in the patient's home, so they don't have to get out. They don't have to go to a hospital or another facility. And especially right now with all the COVID-19, we really see the services that we can offer as being a true benefit for the
Sure,
patients in the
absolutely.
community.
In the cost, I mean, I'm certain that staying in a hospital and getting infusion therapies, or even just visiting for the day, is not cheap.
No.
How does the cost compare to what they have to pay, or their insurance may have to pay, versus in their home versus in a hospital? I mean, I'm not saying for an exact number, but is it going to be?
It should be cheaper. I mean, the cost of having to
Or more
maintain
we
a
use the
state.
word more cost
It
effective.
would be more cost effective, not cheaper. If you consider the costs of having to be, monitored 24/7 in a hospital for patients that aren't in that serious of a condition, although they still need to continue their IV antibiotics per se. This therapy, because of COVID, I see it strongly moving to the at-home setting. In the past, we have seen maybe not all insurances are receptive to that type of therapy, but I think amidst all these changes going on right now, that it's going to be the treatment of the future. Is maybe not even having to admit a patient to a hospital.
Right.
Say they go to the doctor and they're very sick. It is more cost effective to continue therapy in your home, and we can provide those services at a much lower cost than someone in a hospital can.
Okay. So if somebody were to be in that situation, what do they do? How do they make that determination about whether or not they want to do it at home versus and utilize a locally owned company versus maybe a big chain company out of Kansas City or a large, urban area? If someone's getting dismissed out of the hospital in Joplin,
Mm-hmm.
and they want to use a local community pharmacy like BioEthics, what do they do?
It's just simply a matter of requesting BioEthics Advantage to take care of their services. They generally have a caseworker that sets up that, whether it's through a doctor's office or through the hospital. They can indicate or express that they would like to receive services from our business, and information is exchanged between us and the caseworker. We set up billing and approval for payment through your insurance. We don't necessarily have to bill insurance, though. That being said, we can operate on a cash basis as well.
And I have actually seen some cases where it's actually more cost effective for an individual to pay cash for it
That
than
is true.
if they've got a high deductible and you bill insurance, it may be $2,000 and you may be able to get it for cash for $500.
Yeah.
And you're going to pay $2,000 or $500,
Right.
and it's kind of a no-brainer there.
Exactly.
Now, if someone has questions about this, if they have a loved one or somebody that's on, can they call the pharmacy and talk to you and learn more about their therapy and whether or not, maybe it's a chronic therapy. Maybe they have hemophilia or something that's going to require, immune globulin or something that's required a continual infusion or a continuous chronic infusion, maybe not continuous, but chronic infusion is the word I'm looking for. Can they call and talk to you or one of the nurses here to learn more about their therapy?
Yeah. Actually, our hours are 9 to 5, Monday through Friday. You can reach out to us, speak with any of us, Tawny, Heather, Debbie, myself, Lori, any of us are able to help you with any questions that you may have, and kind of get you set in the right direction as far as how we can take care of you or your loved one if you have a family member that is in need of those kinds of services.
And so what if somebody has an insurance and they're saying, nope, you have to use this other pharmacy? Is that always the case? Because I know sometimes I find out that sometimes these insurance companies are not telling them the complete truth. That
is true.
What you see a lot?
We do have instances where we have kind of had to check and double check and recheck just to make sure that additional services from an outside source or from away from the norm of where that insurance company likes to do business.
Sure.
We just have to dig in a little bit deeper, and we're more than willing to do that.
Well, that's awesome.